have lots and lots of questions, from students. So I'll give you a minute, while I am picking up a few very interesting questions. So
Okay.
there are a lot of myths which can be broken as well, because that might be a mindset of the student, might not be true. All right. So first question is from Isha. She's saying that if a student applies for residency, and does it matter the home medical school, in the sense that if more people from my med school are getting matched, will it be an advantage for me? And if nobody in my college has ever applied for residency, will I be in a disadvantaged position?
Yeah, I think that's a great question. It's something all of us think about. I thought about, but what I would like to emphasize is that we need to start somewhere. For example, if you're from a medical school that has never had someone do USMLE, you can be the first one. You know, for example, I came from JJ, so we had a lot of seniors, a lot of lineage, and a lot of people to talk to who've gone through the process. And as I said, it helps because the people in the office know what to do, because I think that's a very important part of all of this, because there's a lot of paperwork which needs to happen correctly and in time. But yes, it matters, because if your senior is in a hospital here and he's done well, the program director may look at it as a positive thing on your application. Sometimes we're able to even ask our directors to look at our colleagues' application, and sometimes they feel reassured if they're coming from a medical school that that person may be from, so they know what they're going to get. But having said that, if you're not from a medical school that is well known, that does not mean that you will not be matched or you have a disadvantage. You can still do all the legwork that you need, which essentially is talking to people, learning from them and getting feedback from all different parts of your application.
All right. Again, it's a too premature question, but yeah, I mean, what has happened is, due to COVID, a lot of these clinical rotations have become virtual rotations. And of course, we haven't got the result of match this year. In fact, the interviews are still going on. But still, there is a question from Nida. How does a virtual rotation, LOR, or virtual rotation work vis-a-vis the hands-on rotations, for your residency application, the clinical
Right.
rotation? Yeah.
Right. Of course, it's not the same. It's all of us are going through the pandemic. So, all of us know what students, applicants are facing. So, no one's going to hold that against you. It's important to know that whatever is happening for everyone. Yes, it's a disadvantage, of course, even for people who are studying in medical school, for example. So, 2 weeks ago, I was teaching some medical students who are here at Harvard Medical School and who are supposed to be on campus, but now we're doing Zoom sessions for them where we're teaching them physical examination. So everyone knows it's not the same, but it's a pandemic and we're all facing the same obstacles. So no one's going to hold that against you. There are different learning curves and things that you need to get used to, but you yourself will not be at a disadvantage because this is something everyone is facing.
All right. So next question is from Bharat. He's asking, can an IMG get into a surgery specialty, or to be specific, neurosurgery? How tough it is, and what should one do to ensure, a surgery match?
Yeah, so definitely it's one of the more difficult matches. For different reasons. Traditionally, it's been very difficult for IMGs to match into surgery programs like orthopedics or plastic surgery. Having said that, I know of a few colleagues who have matched into surgery and even neurosurgery. What I would say is you need really good scores. So for whatever reason, if your USMLEs are not good, then you really need to think about what you want to do, because it might not work out in the end. Unfortunately, there are surgical programs, have different requirements, and sometimes one of that is high scores. And if you don't have that, not to say you cannot match, but I think it's all about numbers. When we talk about USMLE, it's all about the odds and taking your chances and putting your best foot forward. So you need to make a realistic decision if you want to do surgery or neurosurgery, and if you don't have high scores, you really need to think about what the next step should be. So it's possible, but it's very difficult.
All right. Next question is from Rohit. He says, if I do a research with ICMR, can I get those research papers published on PubMed?
So I think so I've done some work with ICMR, but I think it really depends on the journal that he's talking about. If that journal is on PubMed, then yes, it's going to be available on PubMed. But so going back to the question as to what someone can do when they're in India in medical school, and I think we spoke about this, is there are things that you can do and things you cannot do. Unfortunately, as I was mentioning, the letters that we get from India and the papers that we do in India, they may not be as well looked at, but they do realize that where you're coming from, and that's the opportunity you have. So not to say that it's going to be discounted, but of course it's not the same as the paper that you would do in the United States, which brings me back to the rotation, which is why the rotation is important, because you just don't do the rotation for the clinical side. You also do it so that you can pick up one research project before you finish and have that done with a physician in the United States.
All right. So I think students have been listening to you very, very, carefully. So, and they want further insight. So, there's an interesting question from Parva. Parva says, "Can you tell us about your routine as a medical resident? What was your routine actually?" Yeah.
Yeah, I think that's a good question. It's important for everyone to know, because when we train in India, even myself, we think about how things may be in the United States, and we have preconceived notions, good and bad things that we may think will be the case when we're a resident. So typically, as an intern, intern year is the busiest of your 3 years as a PGY1, because you're new to the system. You're learning, which is a big transition for all of us to make. You have to get used to a few different things that happen as a culture here in the United States, in terms of the amount of, unfortunately, in today's day and world, we spend a lot of time in front of the screen, even in the hospital, typing patient notes. So because documentation is very important in this country, so everything that you do for a patient, or you talk to a patient or a family member, has to be documented, or otherwise you will not have any proof that this is what you did for the patient. So you spend a lot of time. So typically I would be at the hospital at 7 a.m. if I'm on my ward rotations, um, getting sign out from the person who's working on the night shift. So starting at 7 a.m. So typically as an intern, you will take care of anywhere between 8 to 10 patients as on the floor rotation. Um, and typically, the ward team is built such that there are 2 interns, 2 PGY1s, and 1 PGY2 or 3 who oversees your 10 patients each. So you're responsible for seeing the patients every day early in the morning, pre-rounding, let's say from 7 to 7:20, and then going back to your workroom, talking to your senior as to what the plan should be for the day, and then typically morning report, which is a case presentation or a lecture by one of your professors from 8 to 9, and then you go to your rounds from 9 to 11:30 with your attending physician. You may have medical students, so you're also teaching. As an intern, you have the opportunity to teach your medical students, which I think is a very good skill to have. And then 11:30 is lunch, and then you go to noon conference, 12 to 1, and then from 1 to 4 you take new admissions coming in from the ER, and you finish your notes and you sign out at 5 p.m. So that's a typical day on a floor rotation. ICU days are a little more busier, from 7 to 7, and of course you'll have night shifts where you're working not as an intern, but maybe in your second and third year, from 7 p.m. to 7 a.m. Typically, you work 6 days a week as a resident. You get 1 day off that alternates between Saturday and Sunday, which is your day to decompress and catch up on other things outside of the hospital. And then you'll have clinic weeks where you're in office seeing your own panel of primary care patients, and different programs do it differently. But for me, it was a week of clinic. So if I'm on the floors on the ward rotation for 4 weeks, after that I will have 1 week of clinic, which is an easier week because it's 8 to 5. You're not in the hospital. You're not running around. You're seeing your 6 to 8 patients in the morning, 6 to 8 in the evening. So it's only Monday to Friday, which is when you get your golden weekend, which is the 2-day weekend, which was once in 5 weekends for me. but that's the broad layout. Every program, every hospital does this differently.
I mean, again, it's upon you to answer or not, but yeah, again, students want to know the insights. By any chance, did you face any kind of racism,
Yeah.
violence, or discrimination as an Indian in this journey?
Yeah, no, I think that's important, because in today's day and age, you want to make sure you're in a place where it's safe. I think that's a good question, and I'm happy to answer. But I personally did not, fortunately, have not faced any such instances. Granted that I've been in cities that have been safe overall and nice, and big cities like Miami and New York City and Boston. So very rarely do such things happen in bigger cities. I can understand that this happens sometimes in more rural areas, unfortunately, and that may still be happening. But I myself have not had the opportunity, have not faced anything like this. But I would say that you have to be careful wherever you are. You know, of course, you don't want to be at the wrong place at the wrong time. But I think there are few in far events that happen in terms of facing racism outside the hospital or inside the hospital. Of course, sometimes, unfortunately, if this happens to you at work inside the hospital, you should definitely bring it up to your coordinator, and they'll be very supportive. And your program director, everyone's, now in the 21st century, very aware of all of this. And if anything like this happens, they'll be very happy to talk to you and make sure that things are rectified.
All right. So, we have a lot of students who are Indians, but, they are doing their med school from Russia, Ukraine, China, Philippines, Georgia, attending this webinar as well. So, their question is, do you also see people from these countries, getting match? What is your take on it?
Yeah, so I've had a few friends that have come through this route who were in India for whatever reason, went to Ukraine or China or Russia to do their MBBS. So, definitely it's something that's not looked down upon. You're going to be at the same level playing field as anyone else. And it really comes down to, what you do in your application and what you do in your interview. So I don't think that's a disadvantage at all.
So we have very interesting questions. So Preetam Kumar says, okay, all right. So can moonlighting help make me extra money during residency? How can I make some extra money during residency?
Yeah, so that's a fair question. A lot of my friends, have thought about this. Some of them have done it. So it's understand to know what the J1 visa means. The J1 visa means that you are being paid by one employer in the United States. So that means that you should not be earning money outside of that one employer. So I know people who have done moonlighting at the same hospital because technically they are being paid by the same employer. So I think once you pass your step 3, you're allowed to moonlight. But there are very rare occasions that people get time in residency to do this because we're so busy. But if you really want to push yourself and do this, there are ways to do it. But it's not typical, and you've got to be really careful of what you're doing, making sure you're working at the same institution. But I know some people who've done this.
All right. Next question we have from Deepthi. She says, "Sir, I'm really young to judge a journey of getting selected into US from India. But is it definitely more? According to me, it is more struggle than a normal Indian lineage. So, is it worth putting a lot of time and money in the USMLE process? How it is beneficial compared to getting a PG seat in an Indian medical college?"
Yeah, so I think that's the broad main question that everything comes down to, and we can talk about this. The way I like to put it is it really depends what you want, what your interests are, what your life goals are, because there are a lot of obstacles. It's a long journey. Of course, you need support from your family, your parents, and things like, for example, you may have engineering friends who are settled and making money, etc., way before you will do that. So I think you have to be very well aware of what you're going into before you go into it. And the reasons why you choose USMLE should be the right reasons. It's not all about just making money. You can do that wherever you want eventually. And I personally feel that's not why we went into medicine. So if that's what someone's thinking, I don't think that's the right way to go about this. So there's no straight one answer as to if you should do USMLE. I think it really depends on your interests, your background, and where you really want to be in the future.
All right. Next question is from Namita Kulkarni. She says, "Hi doctor. The question is, does participating in online CME activities by medical schools, prove useful for a match in the resume?"
Yeah, so I personally did not do any of that, but I can certainly see, how people can do that. And I think it's helpful. And I think it's important to go back to the question as to when we're talking about what can students do in India during MBBS, because, of course, your exposure, your opportunities are limited. So what I would say is, nothing goes to waste, whatever you can do. And if you think it's a good addition to your CV, it'll help you. Everything that you put in a CV is basically giving the interviewer a chance to ask you something and a chance for you to talk about something. So if it's something that is interesting, or if it's something that's philanthropic or voluntary, or if it adds to your medical knowledge and skills, and you can highlight that in your interview, I think that's a good thing to do.
Students and parents are worried about the return on investment and expense part of it. So, if ballpark you can talk about, I mean, just broadly, what money was kind of invested in the USMLE journey, just a ballpark figure, and how soon could you recover it? So that's something people would want to know.
Okay. Yeah. I think you may have better answers in terms of numbers, but I don't think it's fair to just put a number. Of course, we can get a ballpark by putting together the expense for each USMLE exam itself, which is a lot, close to $1,000 for each examination. All the trips you make, all the rent you pay, unless you have friends and family that you're staying with for your rotations. All of that plays into it. The application itself, is expensive, of course. Which I think is around $26 for every program that you apply to. So it's important, to make sure that you know where you're applying, making sure that program does visas. You don't want to waste your money on a program that is not doing visas. So I think everyone should spend time beforehand to do the search, because again, last minute, this is not something that you want to do last minute. It's not going to be ideal and not the best use of your resources. But ideally, creating a list of programs that you want to apply to that do visas and that are IMG friendly. Everyone talks about which programs are IMG friendly or not, and certain programs are, certain are not. There are always exceptions, but you have to play by the numbers. So you don't want to apply to big programs, or for example, programs in California which require extra documentation, the PTAL and such, where you would not have any chance of getting an interview. So as a physician, I think anywhere in India or in the United States, return on investment takes time. Because you do save, you get extra benefits as a resident, but you also have expenses that you're taking care of on a daily basis. But I would say that you're able to take care of everything, and I don't think there's a time where you can actually expect a return on investment. And that also depends what your goals are. If you want to be working as an internist right outside of residency, you can take a full-time job, be a hospitalist, and you'll get your returns right away. And versus if you want to specialize and do a fellowship, of course that takes longer.
All right. So many of our audience, many of them are already doing their post graduation in India. Some of them are already in certain teaching positions, so like assistant professor already in India. So does having any academic experience or and PG in India give any advantage in the process?
Yeah, I think so. And I think we spoke about this in terms of age and experience. So I've seen instances where people who've done, for example, MD medicine in India, and now they're doing a medicine residency. So they do like that. And of course, if you're teaching, if you're an assistant professor, associate professor, that helps. Adding to your experience and knowledge. But it's important to know that when you match and work, you'll be an intern, and you may be taking orders from someone who's younger than you. So you should be okay with that.
All right, one very specific question to the residency application procedure. If given an opportunity, student does not get into a categorical program can he, and already has a match for a prelim 1 year PGY1, should he or she pick up that position?
Yeah, I think so. So I've had personally friends who've done this where they have not matched, unfortunately, and they pick up what's next best available. So, I think you have to make a well-informed decision as to whether or not you want to take that year off and reapply. It's important to know that what you do in after not matching is very important because you cannot reapply with the same CV. You have to be more productive. You have to keep on working. You have to show them because the next time you apply, they will ask you, you applied last year, and what have you done since to improve your application? So you should have enough things that you've done and that you can talk about in that 6 to 9 months when you do not apply. So doing a prelim year helps because we talk about the importance of clinical rotations as a student, which is 1 month. So prelim year means basically you're getting exposure for 12 months, which I think is holds a lot of weight. You will then get letters from people you're working with who are American physicians. So that helps. You know, it may get a little tricky and technical in terms of the visa, because sometimes there are instances where someone is doing a prelim year, and if they don't match the second time, what do they do? Because so that's something that someone needs to think about, very closely and have a backup plan if you don't match when you're doing as the second time when you're doing your prelim year, because then your options change in terms of the visa. So, I think you need to take all of that into account. But definitely, something is better than nothing. And I've known people and colleagues who've matched from prelim surgery and medicine to prelim medicine. So, I think the bottom line is any clinical experience is good.
Yeah, and one just last point to add, advantage of the preliminary program is that you also get paid. So unlike the other rotations where you pay the tuition fees, so
True.
that's one advantage which I see. Yeah,
Absolutely. Yeah.
yeah. So one point, one very interesting question from Vinuta Reddy. She says, can a student return back to India? If somebody wants to, settle back in India, does the USMLE process make sense for them as well?
Yeah, I think that's a very good question, and that needs a lot of thinking and thought process into it because what you need to, I think that depends on what your interests are in terms of what specialty you want to pursue. Um, because what my understanding is in India, for example, an American resident once he finishes residency can practice as an internist, as a hospitalist, and they can survive and take care of their expenses and such. But I'm not aware of this position being in India where you can work as a hospitalist. Maybe you can work as a house officer, but I know that nowhere nearly is what anyone wants to do. So ideally, if someone wants to return to India, and my understanding is they want to specialize, I think it's better, it makes more sense to specialize and then return to India, where you can work as a specialist consultant in any hospital.
Absolutely. So I understand. It's been a stretch session. So we'll take up last 2 3 questions. Before we relieve you, doctor, because students, for many, if you have missed out the questions, definitely we'll try to kind of personally email you, and also you could attend the
Oh,
future sessions as well. But we will try to pick up maximum questions which we can. All right. So there's one question. Afan has been listening to you very carefully. He's asking, what do you mean by peer-reviewed research?
yeah. Yeah, that's a good question. It sounds like someone who's done some research. So as I was talking about the journal that you select, there are a lot of journals out there that will publish, and we get emails every day. Can you contribute to our journal? But that journal is not on PubMed. It's not well known, and they may just accept your publication without any review, and that's not good. That's not meaningful research. So what peer review means is that when you submit an article to a journal, they will have their reviewing committee who are experts in the field look at it and then tell you whether or not it's acceptable for publication, and if they suggest any modifications. So peer reviewed essentially means that it's gone through a rigorous screening process by experts in the field, which adds weight to your research.
So Anusha is asking again a very, very specific question. What was your path to the GI fellowship? how did you tailor your CV towards GI, during your residency?
Right. So I'm right now doing my hepatology fellowship. So I've always been interested in liver and GI and endoscopy from my intern year of residency. So there are different ways of going about it. But as I said, you have to be publishing, you have to be doing research. So I myself, was fortunate and able to find mentors across the country who gave me some projects to work with initially, and I was able to publish them, and then moving on from that, going to the society meetings, which I think is important for anyone who's interested in any subspecialty to do, because all the specialties here in the United States have annual meetings, one if not two every year. Of course, now the last 6 months have been all virtual, but these meetings allow you an opportunity to present your research, meet experts in the field, network with them, get to know them, potentially establish professional working relationships where you can work on research projects even when you're not physically in the same location. I think it's important to stay committed and motivated to your specialty. I think that's what they like to see when you do apply, that, never, despite all the obstacles, you continue to work and publish, in good journals and are active in societies, and are really interested in that specialty.
All right. Faisal is asking, are the program directors in US humble enough to give good LORs?
Yeah, yeah. So, all of us, have that apprehension, and I myself did, of course, 7 years ago. But, when you ask someone for a letter, there are two ways of doing it. When you start a rotation, you just work with them, work hard, come early, leave late, come on weekends, and then at the end, tell them, I'm finishing tomorrow. Can I meet with you 5 minutes? Because everyone here in the United States has a busy clinical life. They like appointments. And the best way to talk to them is to meet them, sit down in the office when they're not busy with patient care, even if it's 5 minutes. And you tell them, I'm finishing my rotation, I'm applying for residency, and they understand you need a letter. Most of them, if not all, are very helpful and supportive. And the other way of doing it is, which I don't think I would do, but I know people who do it, is when you start the rotation, in the first few days, you tell your attending, I'm applying, I need a letter, tell me what to do, and I'll do it. That's one way I know people have gotten letters. So you establish your relationship with them, get their emails, and ask them for a letter 6 to 9 months down the road, and making sure you give them enough time, because believe it or not, it can take weeks or months for them to find even 30 minutes to write you a good letter. And making sure you have your CV, and sometimes they might ask you for a draft letter, which works in your favor. You can put on there what you want them to highlight, and otherwise sometimes they will just write it themselves. But it's important to be ready to go with all this information, so when the time comes, you can give it to them at the earliest, and they will upload your letter for you. No one in the United States writes a letter if they don't want to support you. Like, no one will write a bad letter. So it's important to understand that if someone writes you a letter, you of course tell them that I'm applying, I need a strong letter. All of them have been through the process, they know what it's like, and they're happy to help you as long as you're good about it, professional, and give them enough time. So, in summary, no one's going to write you a good letter, and if you want one, even from a PD, that's totally possible as well.
One last question. I understand it's been a very heavy schedule now. Mavra Jha has been listening to you very, very carefully. There are two questions. How and where did you apply for research position before residency? Was your research position paid? Yeah, before you actually got your residency. Yeah.
Yeah, I think it's a great question. So the way I got my research position was at the same institution where I came to do a rotation. So I did my rotation and I went back to India to finish my internship. And then I learned of a vacancy in their research department where one of their research fellows who was working had matched into residency and he was leaving. And that's the field I wanted. That was the GI department. So they had seen me, they knew me. So I applied and they gave me the research position. The other way of doing this is finding it online. Emailing coordinators. It can take a lot of work, but you have to be prepared to send those emails, and you'll get maybe 1 or 2 replies out of 100 emails that you send. And it was not a paid position, so my research was not a paid position. I know some people who've had research positions that are paid, but the one that I was doing was not.
All right. Thank you very much. I know it's been a very long schedule. I really appreciate you've been very kind enough to, in fact, give a lot of detailed answers and insights which normally a student would not, get opportunity back in India. Appreciate your time, students. Thank you very much, all of you, to be also part of this session. One last message for our students. Just a parting message before we kind of move on.
Yes, no, absolutely. Thank you, Chirag, for this opportunity. I think it's been a pleasure to talk to everyone, and hopefully I was able to provide them some useful tips. What I would say in summary is that it's a long but rewarding journey, but everyone should really make a decision for themselves. I think it's a very personalized and individualized decision as to whether or not you want to do USMLE. And there will be obstacles. There may be things that do not work out, and things may take longer than you expected. But if this is what you think you want to do and work in the United States, and you've got to be prepared for some sacrifices that your family is going to make on a daily basis. And you realize this a few years down the road, things are not the same because you're in a different time zone, and that really is a big obstacle because you have only one day off, and with the time zone, it's very difficult to be able to sometimes even talk to your family for weeks, and take care of things that are urgent. So everyone really needs to take all of that into consideration, and not just focus on one aspect of this journey. It's certainly doable. It takes a lot of work, but if you're motivated and you put your efforts into this, I think everyone is able to finally get what they want.
Thank you very much. In fact, the students have already been posting. Parva, Ajinkya, Nida, everybody has been thanking you, and they've been patiently listening you. Thank you very much, Dr. Jinendra. Hopefully, if given an opportunity, as we discussed, if there is a possibility, we will be definitely looking forward where Moksh Academy students could get some case study discussions with you as well. So yeah, let's see what lies in the future. But thank you very much, students. Thank you, Dr. Satya. And once again, I appreciate all of you to be part of this session. Appreciate entire student community. There will be a lot of people who got their friends. So we've almost reached about 700 students attending this session live with you. We'll send you the details as well. Thank you, everyone. I will end this session now. I appreciate all of you to be part of this session. Thank you.
Thanks so much, Chirag.
Yeah, thank you. Yeah.